each child or each person with autism has their own unique set of strengths and challenges. And it's also important to know that individuals with autism might also have other behavioral and medical difficulties. One thing that you want to think about is communication. Individuals with autism communicate perhaps in different ways. This can range from verbal, full expressive communication, as many of us commonly think about. It can also include not much expressive language or verbal communication and maybe more receptive language. So this individual might understand a lot of what you're saying, be able to follow what you're saying, but may not be able to express that in the same way. So we often ask families who have children with autism, what is the best way of communication? Is that communication via 1 to 2 words, full phrases, no language perhaps? Are there different communication devices that their child might use? Things like an iPad or a picture book that helps the child communicate. In addition, other things that you might want to think about or might occur with a child with autism is difficulties with attention and focus, or something that you might have heard of commonly, such as attention deficit hyperactivity disorder. What that really means is sometimes if there's more difficulty with attention and focus, it's thinking about ways in which you might be able to help with that, which we'll talk about a little bit more. Other behavioral difficulties can be irritability, something that's important to ask a family about. Also, sensory issues. So what that can mean is having difficulty with certain sounds or other sensations, or sometimes having preferences to other sensations or sounds, such as tight squeezes, for example, or maybe something that they often use to hold on to or that they prefer in between activities. Another thing is epilepsy or seizures. That can be common in individuals with autism, and that's something that's important to talk to a family about if they're concerned about that, and things that to maybe look out for. Sleep difficulties can also be an issue. But overall, knowing that each child, again, is very unique with their own sets of strengths and challenges, and what's most important is asking parents what is helpful from working with these children and what might be some of the difficulties that they face.